So, when you think about herpes, what comes to your mind? Any of those maybe? So what are they actually? Well, herpes is a viral infection caused by a virus called herpes simplex virus, HSV, which can be divided into two, HSV1 and HSV2. Now, HSV is an enveloped, double-stranded DNA virus from the family Herpes viridae, which consists of many types of human herpes virus. In this video, we are going to talk about the epidemiology, causes, symptoms, treatment, prevention, and pathogenesis of HSV.
In 2016, an estimated 3.7 billion people under the age of 50 or 67% of the population had a herpes simplex virus 1 infection. Estimated prevalence of the infection was highest in the Africa, which is 88%, and the lowest in the America, 45%. With respect to the genital HSV1 infection, between 122 million to 192 million people aged 15 to 49 years were estimated to have genital HSV1 infection worldwide in 2016, but prevalence varied substantially by region. Most genital HSV1 infections are estimated to occur in the America, Europe, and Western Pacific, where HSV1 continues to be acquired well into the adulthood. Genital herpes caused by HSV2 and an estimated 491 million, which is 13%, people aged 15 to 49 years worldwide were living with the infection in 2016. More women are infected with the HSV2 than men. In 2016, it was estimated that 313 million women and 178 million men were living with the infection. This is because sexual transmission of HSV is more efficient from man to woman than from woman to man. HSV1 is mainly transmitted by oral to oral contact to cause oral herpes infection via contact with the HSV1 virus in sores, saliva, and surfaces in or around the mouth. However, HSV1 can also be transmitted to the genital area through oral genital contact to cause genital herpes. HSV1 can be transmitted from oral or skin surfaces that appear normal and when there are no symptoms present. However, the greatest risk of transmission is when there are active sores. Individuals who already have HSV1 oral herpes infection are unlikely to be subsequently infected with HSV1 in the genital area. HSV2 is mainly transmitted during sex through contact with genital surfaces, skin, sores, or fluid of someone infected with the virus. HSV2 can be transmitted from the skin in the genital or anal area that look normal and is often transmitted in the absence of symptoms.
In HSV1, oral herpes infection is mostly asymptomatic and most infected people are unaware they are infected. Symptoms of oral herpes include painful blisters or open sores called ulcers in or around the mouth. They will often experience a tingling, itching or burning sensation around their mouth before the appearance of sores. After initial infection, the blisters or ulcer can periodically recur. Genital herpes of HSV1 can be asymptomatic or have unrecognized mild symptoms. The symptoms is characterized by one or more genital or anal blisters or ulcers. After an initial episode, which may be severe, symptoms may recur. However, it typically does not recur frequently, unlike genital herpes of HSV2. In HSV2, genital herpes infection also often asymptomatic or unrecognized mild symptoms. Also, they are unaware that they have the infection. The symptoms is also characterized by one or more genital or anal blister or open sores called ulcers, and the new symptoms found include fever, body ache, and swollen lymph nodes. After an initial genital herpes infection with HSV2, recurrent symptoms are common but less severe than the first outbreak, with the decreasing frequency of outbreak, but it takes many years. Infected people may experience sensation of mild tingling or shooting pain in the leg, hip, and buttock before the appearance of genital ulcers.
Now we will be going over the pathogenesis of the herpes simplex virus. For the primary infection, the virus first enters via the skin or mucous membrane upon contact with an infected individual. The main site of implantation being the skin and mucous membrane, after which the virus will infect epithelial cells and initiate the lytic cycle. During the lytic cycle is when viral replication occurs, which is done by the infected cell synthesizing new copies of the virus until a cell bursts, releasing the new viruses to infect neighboring cells. Primary infection is often asymptomatic. However, when symptoms do appear, they present themselves in the form of herpetic ulcers and lesions on the skin. For cases of HSV1, herpes ulcers will form around the mouth. In cases of HSV2, the ulcers form on different parts of the genitals for males and females. HSV can also infect other body parts should they come into contact with an infected area. Common parts are the fingers, which is called herpetic whitlow, torso and head, and even the eye, with varying levels of severity. After initial infection, the virus can enter a period of latency after disseminating in the body. It most commonly infects the sensory neurons, where it can persist indefinitely by traveling up the neuron's axon and settling in the cell body for life. Reactivation of the virus involves it producing copies of itself that travel down the axon and infect epithelial cells, causing a recurring episode. Reactivation can be triggered by a multitude of factors that activate different cellular processes to result in increased HSV lytic gene expression. These factors include stress, irradiation, bacterial co-infection, fever, and menstruation.
HSV1 is the most contagious during an outbreak of symptomatic oral herpes. Those people with active symptoms should avoid oral contact with others and sharing objects that have contact with saliva. They should also abstain from oral sex as well as sexual activity to avoid transmitting herpes to the genitals of a sexual partner. For example, the consistent and correct use of condom can help to prevent the spread, but it only reduces the risk of infection because HSV can be found in areas not covered by condom. And pregnant women with the symptoms should inform their healthcare providers for prevention. For HSV2, symptomatic people also should abstain from sexual activity because the infection is most contagious during an outbreak of SARS but can also be transmitted when no symptoms are felt or visible. To prevent, these people should also receive HIV tests, use consistent and correct condom for partial protection, and make medical male circumcision to provide men lifelong partial protection against HSV2, HIV, and HPV. Besides, pregnant women with the symptoms also should inform their healthcare providers. For treatment of both HSV, antiviral medications such as acyclovir, famciclovir, and valaciclovir are the most effective medication available. This can help to reduce the severity and frequency of symptoms but cannot cure the infection.
So we hope you enjoyed this video, and by watching this, some knowledge about herpes can be gained. Thank you for watching and have a good day.